Okay, it is 4:01 according to my clock. Kristen, where are you?
I'm here.
Okay.
All right. Let me do some things.
Well, while Kristen's getting ready, I have a mask on because I have another person in the office with me. And I will scooter this way. Yep. This is Nicole Peters. She is our new assistant director of nursing. So we had her jump on the Zoom call today to introduce her. This is what, your third week.
Mm-hmm.
So she's doing great. She's actually worked here before. So yeah, getting to know the residents that she doesn't know yet and diving right on in. So she's going to sit in on our Zoom call to see how we do these monthly calls. All right. So welcome. We have Gail on today, our activity manager. Stacy Lee, our administrator, is not here. She's at a conference, so you get us today. The housekeeping rules, we will end promptly at 4:30, and we'll keep everybody muted, and at the end you can ask questions. Gail's going to talk about resident and tenant activities. I'll give an update on COVID and some different visitation guidance right now because of our outbreak status. So we will dive right into that. And there's our housekeeping rules. All right, Gail, you can unmute yourself and.
Can you hear me?
Yep.
Okay. Well, good afternoon, everybody. As you can see, there's some pictures here. So we have been busy doing things. We've been making crafts, doing manicures, keeping our tree in the hallways in each neighborhood up to date to what season is going on. We had a hat day, as you can see some of them. And just a little bit ago, we got done with bingo. And one of the things that's been really nice recently is that we've been able to have the people from the assisted living join us too for things like bingo, and they've been coming down to the beauty shop and getting things like that done. They don't have the capabilities right now of watching like our movies and stuff, or like the Dawson Sentinel reading up there, but for right now they can come and join us in the chapel area and watch it from the TV screens there. So that has happened too. So it's nice to see the interaction. And also the assisted living is going to be working on some new spring group projects. So some new things will be coming up there, and they continue to do their bingo and crafts.
They have the break coming.
And also our menu magic team met today. So we continue to work on food enjoyment and trying to make improvements as the residents request. We got outdoors one day when it was really nice, and we're waiting for the nice weather to come back again so we can do that and get going on some golf cart rides, and hopefully eventually on some bus outings with limited numbers of people. We continue to have our musicians come. They are in the chapel and the residents watch it over the closed circuit TVs. The same with the Dawson Sentinel reading, and we are currently still doing country store and happy hours, you know, traveling from room to room. And one of the exciting things for this next week coming up is the staff is going to be training on our new IN2L computer system, and that's going to have a lot of new capabilities and a lot of different things that we'll be able to do. And so we are anxious as staff for ourselves to learn so that we can pass things on to the residents, and hopefully there will be a lot of different things that they'll like to do. It's all touch screen, and there's going to be one in each neighborhood, plus there's a portable one that can go to rooms. So And we'll also have the capability of projecting it onto our big screen in the chapel area. So we're excited about that. So currently, as you know, the visits are suspended and the pastors were coming to, and so that'll change for now too. We'll have to do that over the closed circuit TVs again for a while until we can resume those type of things. But otherwise, we are doing things and getting out. So guess that's it for me. Thank you.
All right, thanks, Gail. So the slide we are looking at now are the COVID-19 cases by county, and this information is from the Minnesota Department of Health. So cumulatively, so over this whole COVID pandemic, the confirmed cases have been 737. Our active cases right now are 9. So there are 9 active cases in Lackawanna County. However, from 1 month ago, we are up 35 positive cases from a month ago. So we've definitely seen an uptick in our clinic with people having symptoms and getting tested. So we will have to work hard on all of our infection control practices and social distancing, and hopefully we don't continue to see this climb up. And we'll go to the next slide to look at the positivity rates. So the next slide is our positivity rates, and these are based on data from April 13th. Lackawanna County is in the green, and that means our positivity rate is below 5%. So it is at 4% as of April 13th. We had been above 5%. So we had been in the yellow, but it did drop back down. Our neighbors in Chippewa County, they are at 4.3%. So they're in the green. But Swift County, they're yellow, they're at 8.9%. So definitely we're seeing an increase in COVID cases around us as well. Minnesota is in the yellow. At overall as a state, we're at 7.7% positivity rate. So we're seeing our neighboring states also climb up a little bit. The Johnson Memorial Long-Term Care COVID cases, we did have one employee on the long-term care side test positive for COVID on April 19th. So yesterday, those test results came back. This employee was not a direct care employee. So it was not an employee who was providing the direct care, like the personal cares to the residents. So we do consider this to be a fairly low risk exposure to anyone. The employee faithfully wears their PPE. So we feel confident that we should not see any exposures or any more positives. However, when we have one staff or one resident test positive, that is considered to be an outbreak, just one positive. So that puts a few things in process. One of those is we have to suspend some of our visitation, some of our indoor visitation. Kristen, what's the next slide look like? Okay, so I'll keep on going. So one of those things is we suspend our visitation and we limit to only certain types of visits. Another thing is our residents and employees will do COVID testing tomorrow on Wednesday, as well as next week on Wednesday. We have to have 2 weeks of negative results in order to get out of that outbreak testing. So right now on the slide, we're looking at the long-term care visitation guidance flow chart for outbreak status. And for those of you listening and not seeing the screen, I'll kind of explain what the flow chart looks like. So the first box is, does the facility have a new COVID-19 case among residents or staff? So yes, we do. We have one employee who tested positive yesterday. The next step, immediately suspend all visitation. Now there is an asterisk, so I'll tell you what those exceptions are, and begin outbreak testing. So visits that we cannot allow, or excuse me, visits that we must allow to continue are compassionate care visits, essential caregiver visits, and visits required under state and federal disability rights laws. So if you feel like your resident qualifies for a compassionate care visit, or if you feel like you are an essential caregiver, please reach out to myself or Gail and we can talk about visitation. You know, certainly the fewer people coming in and out during an outbreak status, the better. But we do recognize that the residents, there are some residents who really need that consistent contact from their family members, or their family members are assisting the resident with some of those daily care needs or eating assistance, things like that. Okay, so we have a positive employee. We suspend visitation with the exceptions of those I listed. The next step is the first round of outbreak testing. So tomorrow, all employees and residents will be tested. Typically, we get the results back in 2 days. So I'm hoping by Friday, we will have all of those results back. And we're gonna hope and pray for negatives. And then next week on Wednesday, we will do our second round of testing. And again, we will hope for negatives. Let's see here. I'm just reviewing the flow chart. Whoops. Sorry, my phone started ringing and I've got to put that I'm in a meeting. All right. So if we have 2 weeks of no additional COVID cases, we can resume indoor visitation in the areas where there are no COVID cases. So essentially, because it was a staff person and that person is now quarantined, we could begin indoor visitation once we get 2 weeks worth of negatives. All right. So I think we can go on to the next testing. Residents and tenants were last tested on Monday, January 11th, so they have not had to be tested for quite a while. We will be testing everyone, like I said, on Wednesday and then again next Wednesday. Our long-term care staff, we had been testing just once a month, with our last testing being done on March 22nd. Next slide, please. Vaccine information. All care center residents are fully vaccinated with the exception of one, but this resident will receive their first vaccine next week. And all of our assisted living tenants are fully vaccinated. So we talked about care center visits being suspended due to being in outbreak status. For those who qualify for a visit during the outbreak status, we will continue to reinforce the infection control protocols. We ask that you schedule in advance with the activity department. Masks have to be worn at all times, and you will be screened prior to entering. Next slide. So no changes is regarding the number of visitors the resident can have at a time, still 2 at a time. As far as the time limits, we're willing to be flexible on that based on how often you're coming to visit or the distance that you're coming to visit. So talk with whoever you're scheduling the visit with and see if we can agree upon a length of time for the visit. All residents and tenants who have been vaccinated can choose to have close contact with their visitors. So that means they need to use hand sanitizer before and after, they can hold hands, and masks need to be worn during the visit as well. Let's see here. We ask that visitors use the River Road and Prairie Lane entrances for now. And we do have a link to the newest visitation guidance on our website. You can schedule visits. You can email that to the activity department. That email address is jmhsccvisits@jmhsmn.org, or you can call directly to the activity department. Assisted living visits, this employee had no contact up at the assisted living, so visitation will still be allowed for assisted living tenants. Go ahead, Kristen. And then just a reminder with our communication, Stacy does a weekly update to the residents to just give them the most recent updates regarding visitation, testing, vaccine. Our monthly newsletter is either mailed or emailed. Always can go to our website. The Healthline is a monthly newsletter that gets emailed. If you're interested in receiving that, just let us know. Social media is a good place to find updates. And then our monthly Zoom calls, which are on the 3rd Tuesday of each month at 4 p.m. As of right now, we'll plan to have our next update in 1 month. However, if we should get test results back and we're getting more positives, we'll probably schedule another one within a week or 2 just to give an update on what kind of trends we're seeing regarding positives. So I hope to not see you guys in a week or 2 weeks. I hope to see you in 1 month, but nevertheless, we will schedule more Zooms if we need to. Don't hesitate to contact myself or Stacy Lee or Gail or really anybody. We're happy to answer questions if we can. And that's enough of me talking. What questions do you guys have right now? And Sandra are they able to unmute themselves, Sandra? Or Sandra, oh my gosh. Kristen.
Yes, they can.
Okay. Any questions? Are people on the phone able to unmute themselves?
They should be able to.
Okay, I wasn't sure if they had to do something special. Okay.
Oh. Are you saying that you can't unmute yourself, Jordal?
No, she's through the computer, it looks like.
Okay.
Oh, she can't unmute herself. Oh, I'm not sure what that means.
You should be able to. I
The
took
host
that
has
off.
blocked us.
No.
No. So Kristen's just trying to figure out if there's something preventing people from unmuting themselves. Diane, are you able to unmute yourself?
She unmuted me.
Oh, perfect.
Fantastic. This is Cheryl Jordan. So my question here on this is that, and You know, there's probably other people that just like to drop off, and I can contact you directly. But if the residents are all vaccinated, and I assume the majority of the staff is, then what is the concern with not allowing additional people in to visit? Are you concerned that people, visitors coming in who aren't vaccinated could get COVID? Or are you concerned that they're bringing in other strains? I'm just not quite understanding this no visitor thing.
Sure. No, that is a great question. And the Minnesota Department of Health sets the guidance as to what we have to change regarding visitation if we have an outbreak. And again, an outbreak is considered one positive. Yes, nearly all of our residents are fully vaccinated. A decent over 50%, I believe it's maybe even 68% of our long-term care staff are fully vaccinated. But we don't know if the employee who was positive, we don't know if the vaccine that we all received is effective against whatever strain that employee had. So really, we have to follow the guidance from the Department of Health, and they say to suspend visits with the exception of the visits that I talked about earlier. Anybody else have any questions? Okay, not hearing any. Thank you for joining us on this week's Zoom call, and be on the lookout for an email in the event we call another Zoom call within the next couple weeks, but we'll hope to not see you for a month. So thank you guys for joining us.